greater commitment to the policy frameworks. So I just mentioned the medium-term national development policy framework, and the figures there, the targets are very ambitious, but the budget performances are telling us that there's a lot of variance between the planning and what actually goes into that. There is also a health policy, and one of the objectives is to ensure sustainable financing for health. That seems not to be what the budget is telling us. So we want government to be really measuring how they craft their policy objectives and targets. Then the second is to establish the Ghana Center for Disease Control by appropriating adequate funds for it. So if Parliament has not really yet approved it, and the discussions are still going on, we are calling on them to shift the lines and focus on the Ghana Center for Disease Control. Then, if it takes steps to execute the health sector budget as planned, it's very necessary. So we are saying improve the capital expenditure and goods and service budget execution rate. So it's not just enough to allocate, but at the end of the fiscal year, we want to see that commitment translating to, if the margin is even around 10%, that is really good. Then we also observe that when you combine all domestic sources for infrastructure, development partner is doing close to double for infrastructure, and we think it's not sustainable. So we said minimize the dependence on development partners for health infrastructure development. For the first time, we've seen for the ABF, with the oil money that comes to health, have reduced a little bit. So we observe that maybe the health is not that a priority to use the ABA for, but we are still calling government, because we know that the ABFA is a sure and sustainable source. Once the oil is lifted, the money comes. So when they give you something from that line, you are sure that you get the money. Then we also call on government to consider epidemic preparedness and response funding in the appropriation of the funds within the health ministry budget allocation. And then the last one, but not the least, is that the proportion of the COVID-19 levy should be appropriated for the establishment of public health emergency and response fund as recommended in the National Action Plan. So in the budget, they told us that as much as close to 230 million Ghana cedis was raised from the COVID-19 health levy. And it's even projected to go higher in 2022. So we want them to consider how they spend that and give some to the emergency response fund.